So disclaimer, so the information is for educational purposes only. So anything that I discuss and the questions that I answer are just for educational purposes and not individual healthcare advice. Obviously, I would recommend that you go to your own individual healthcare provider for that. And I am UK based, so the majority of the legislation and such like is from the UK point of view. Obviously, I do understand a bit of the differences in legalities across the world, and I will say that if I know that. So, and here's my intro. And as my intro says, I would appreciate it if you like and subscribe. For some reason, YouTube keeps knocking subscribers off. Now, I don't know whether that's people come back to my channel and realize that they didn't actually like my content and remove me, or whether it's just YouTube times people out if they haven't actually engaged with me. So if you can double check whether you're actually subscribed and subscribe to me, that would be brilliant, because I am aiming to get to the 1,000 subscribers so that I can eventually get myself monetized. Hello, Amber Better. Hello, Lisa. Yeah, supplements are interesting. Yeah, there's just so many out there. Basically, I would say there's possibly getting up to 1,000 different supplements. And yeah, they're very confusing. Hi, not that Kate. Well, I'll just call you Kate from now on. So the main supplement that I've taken on and off over the years, and that I still do take, and I probably will be, although I haven't been taking it over the summer, which is a clue to what it is, I will start taking it now that we're into getting into the autumn and the sun's disappeared suddenly. So that is vitamin D. And I would have to say that probably vitamin D is probably the one vitamin that the majority of people who live above a certain level in the northern hemisphere or a certain level in the southern hemisphere. So obviously, if you're in the equator zone, you probably get enough sunlight the majority of the time. But in the more sort of tropics and higher towards the Arctic Circle or the Antarctic Circle, we don't get the same amount of sunlight, especially in the winter months, and our weather can be very unpredictable and we get the clouds in the way. And although we should be able to get the majority of our vitamin D from sunlight, we can't. It doesn't actually appear in many foods. There are some foods that it is in, such as you may get it in some of your sort of oily fish, do have a certain amount of vitamin D. Mushrooms, if they've been exposed to sunlight, do have vitamin D. So when you see mushrooms being sold and it says fortified with vitamin D, it's usually because they've left them in the sunlight for the last little bit of growth, so that they've actually absorbed some vitamin D. But other than that, it's actually fortified food. So unless you actually buy foods that are fortified, such as your sort of your breads and your cereals and such like, a lot of people may not be sufficient in their vitamin D. If you do think that you seem to have the symptoms of muscle aches, well, people say bone aches, but sort of generally joint aches and lack of energy and sort of catching more sort of colds and infections, and you think you might be low on vitamin D, it is always useful asking for the blood test from your GP or your doctor to say, I once was tested years ago and I did have low vitamin D levels, so I did treat with the high dose vitamin D course over sort of a 12-week period, and so now every year I do take vitamin D supplements over the summer, over the winter months, to just make sure that I don't go back into that insufficiency. People that should be thinking about whether they need it, but obviously they should talk with either the midwife and the OBGYN, is people that are thinking of becoming pregnant or who are pregnant, because obviously you've got the growing baby that needs to grow the bones. Obviously, as I probably forgot to say, but vitamin D is essential for allowing you to absorb calcium and for the calcium to actually get absorbed and put into your bones. But vitamin D is more than just that. It also helps your immune system and many more things. So, yeah, so in the UK, some of the cartoned milk, so not the plastic bottled cartons, but the sort of UHT cartoned milk can be fortified with vitamin D. But normally they add it to the breakfast cereals or to yogurts and such like, rather than actually just the pure milk. But yeah, obviously adding vitamins and minerals to food obviously will alter the taste of it. So yeah. Oh yeah, so that's you as well. I'm trying to go back through the comments. So yeah, hi Nikita, nice to have you here. It's always difficult. There's so many live streams and so much of life getting in the way. It can be impossible to keep up to date with everybody's live streams. So I understand for those that are here on replay, if you need to go through at double speed to speed me up, that's fine. It still helps creators supporting them by watching at double speed. But I have to say, I do quite often watch double speed sometimes, other people's lives, especially when I also start mid-stream. I usually find out about half an hour into a live stream, and then I'm suddenly on catch up playing at double speed to check I haven't actually missed anything exciting. So many autoimmune diseases. So a lot of what they call the DMARD medications and make sensitive to sunlight. They have just put out another new fresh one in the MHRA in the UK about methotrexate causing photosensitivity reactions. But yes, so for people who have medication that causes photosensitivity, or even if their just skin is photosensitive, then they will have to be either wearing SPF or covering up, which then will reduce the amount of vitamin D that is absorbed. So that's the other cohorts of people that may need to have vitamin D supplementation all the time, is people that are either indoors all the time, maybe because of mobility issues or because they're living in a care home and they don't get opportunity to go out and about. People that have to cover up either because of their sort of their beliefs and their religions, or because they just have to cover up because their skin's so sensitive, or they don't like their skin being on show. I know some people with severe eczema and psoriasis, although the sunlight can help it, they don't want that to be visible to other people when they're out in public, so they will cover up, and obviously that will then lower the amount of vitamin D that they absorb. So there's so many groups of people where adding in vitamin D, especially over the winter months when you're in countries that have substantially less sunlight over the winter months, it's very useful to have. How vitamin D is measured, quantified, is different. There's two different ways in the UK, and it probably varies around the world as well. So in the UK, a normal maintenance dose, you would want somewhere between the 10 micrograms to the 25 micrograms, depending on your situation, and whether you just need a little bit or you know that you're always going to need that more. So the 25, which then relates to being in the range from about 400 international units to 1,000 international units. But yeah, I'm not quite sure whether that's the same worldwide and what it is in the US. So it's always worth to check locally, check with your local guidelines. There is NHS guidelines out there on supplementing with vitamin D, and obviously you can always discuss it with your healthcare provider if you think that you may have any medication that interacts with it, which usually that would be things like the calcium and such like, or if you've got any problems with kidney function, it's always worth with vitamin D, because the vitamin D comes in 3 forms: vitamin D2, vitamin D3, and then the active form, which is your ergocalciferol, cholecalciferol, and then alpha calcidol. So ergocalciferol is usually the plant-based vitamin D, and that's usually the one that's listed as being either vegan or vegetarian in supplements. So usually that's the thing, but you can absorb that, but you can't absorb that as well. Your body doesn't absorb that as well as in the next form, the cholecalciferol, the vitamin D3, which is normally found in either sheep's wool lanolin or in fish oils. So it's not vegan. So the majority of vitamin D on prescription is not vegan. In fact, the only product that is available that is vegan on prescription is about £80 a month, which is ridiculous. So we do actually usually have to say to people who are vegan, it's not really available on the NHS unless you've got a severe deficiency that we need to treat. If you are just wanting it sort of as a top up, you need to be going and looking to buy it from a health food shop. But yeah, so the cholecalciferol is the next stage. And the process with vitamin D is you make it in your skin. It's then converted once by the liver from ergocalciferol to cholecalciferol, and then it's converted from cholecalciferol by your kidneys to alpha calcidol, the active form. So people who have got severe kidney disease cannot do that last step. So they actually need to be supplemented with alpha calcidol, usually by the renal unit that they come under. So that was a bit of a waffle, so I haven't gone too fast on any of that. And if you want me to explain any of that, just let me know. Oh, yeah, I did notice, Sam, that you've said quite a while ago that you've injured your ankle. I hope that you've had it checked out. I know sort of me with my family, we've all got Ehlers-Danlos syndrome, so we have a tendency to sprain and damage our joints significantly more. And it turns out that when my uncle thought he'd sprained his ankle, it turns out that he's been walking on his ankle dislocated for years, and then when he actually sprained it, he'd actually got a fracture in there, and he needed it all pinning and plating. But then they pinned it and plated it back into the correct position, which it probably not been in for the last 20 to 30 years, because it'd always been wrong. So yeah, if things aren't improving with your ankle, make sure you get it checked out and physiotherapy. Yeah, Nikita. Yeah, it's always easier with me to say what's not hurting to what is, because Ehlers-Danlos syndrome. I don't know whether I know a few people that have been in some other live streams with sort of DC, and other people have mentioned that they've got Ehlers-Danlos syndrome. But it's a genetic condition where the collagen that's within all the parts of the body is too stretchy and fragile. It means that all my joints can dislocate or sprain easily at any random point. It also affects collagen everywhere, because, well, you probably see that collagen supplements are promoted as being a cure-all, because collagen is basically the protein that makes up the rest of your body other than muscle. So muscle's made up of one type of protein, and then the rest of the tendons, ligaments, skin, all the sort of joining tissue is all made by collagen, and it's a big long protein molecule that's a bit like a triple helix. So you probably all know that DNA is a double helix, so it's 2 pieces of string that's been twisted. Well, collagen is a triple helix, so it's 3 pieces of string that are twisted to coiled, and it makes up all the structures in the body. And for the majority of people, this collagen, between each of the strands, there's cross connections. so that it keeps it nice and sturdy. But the problem with people with collagen, genetic collagen disorders, those cross connections don't match up as well, and so the strands can actually slide past each other. So if you think of a brick wall, normally you have the different bricks of all sort of interlinking. But if you were to just put bricks on top of bricks, then the wall wouldn't be stable because they could just fall over. So that's a bit like it in people with connective tissue disorders. So there's the Ehlers-Danlos loss that I've got, there's the Marfan syndrome, there's osteogenesis imperfecta, and quite a few. But yeah, it causes lots of lots of different problems. Oh, I'm hoping I covered that. So, and you asked the question before I actually said that. So yeah, so in the range of 10 micrograms to 25 micrograms daily, depending sort of on how deficient you think you are, sort of how at risk, whether you do actually have any sunlight or have to keep out of the way. So yeah. Oh, ginger genes. Yeah, I'm not ginger, but I am quite fair. But yeah, being ginger, you've really got to be safe in the sun. It can cause lots of problems. Okay, yeah, it's not all that common. We do class ourselves as zebras because it is known as sort of, you know, an uncommon invisible illness. Okay, I'm glad you had it checked. Yeah, and I hope the physio appointment comes through quickly. Hello, Brittany. Continuing education, right? So I'm just going to remove that because it's quite a lot. But yeah, so yes, we have to do continuing education in the UK to keep our license as a pharmacist. So each year, mine's coming up for October, we have to renew our registration, pay our registration fee, and provide a certain amount of continuing professional development. So one we have to do is a peer reviewed review. So I have to do a set of learning with one of my peers. So one year I chose my line manager, sometimes I choose a colleague, and I have to do a write-up about sort of something that I've been doing in my job, where I've been consultant with a colleague and we've been doing information. So I usually write up something around some set of guidelines that I've been doing and the way that I've been asking for feedback from a colleague and how I've taken on their feedback and taken that on board and done that. Then we also then have to write up a review about how we have ensured that we complete one of the professional standards. So there's 9 different professional standards that a pharmacist has to adhere by that are on the so the General Pharmaceutical Council. If you were to Google that on in the UK, they list all the professional standards that we have to meet, and so I have to write a whole review about how I meet those professional standards with examples that I've done during the last year to meet that professional standard. I am actually going to be writing up this year on how I've maintained my professionalism with setting up my YouTube channel. So that is actually what I'm going to write up about this year. But previous years I've done about sort of my communication with colleagues. So I did about how I did my communication with sort of writing dermatology guidelines. And then as well as that, we then have to do 6 other pieces of evidence of different pieces of learning that we've done over the years. So they can actually be actual pieces of learning where we've gone on a course, whether that be an online course or an in-person course, and write up what we've learned from it, or they can just be writing up where we've done a bit of research on it. So say somebody asked me information about, say, coffee enemas, and I go and do all the research about it, and I write about how I do the research, what I found, and then how I implemented what I learned in my job. So, yeah, I have to do that every year. So, yeah, there is a quite amount of proving that I do the continual professional development every year. So, I hope that was interesting. Hello, Elsie. Nice to have you on. I don't think I recognise your name for being on previous streams, so lovely to have you here. So you can ask any questions you like about different supplements. But seeing as currently I don't have any questions, I'm going to move on to a couple of the other supplements that I've looked into. So for many years, as I've just said, I've got Ehlers-Danlos syndrome, which is faulty collagen. So millions of people have always tried to convince me to take collagen. Hi, Chelsea. So lots of people have convinced me to take collagen, and I have done extensive research in collagen. And the problem is yes, you can take collagen, but collagen is a very long protein, and it's made up of lots of different amino acids in the range of hundreds of amino acids in a long chain. To make this strong protein. So yes, you can drink that and it'll get in your stomach, but there's no way you can absorb that big, long, strong protein through your stomach lining. What your intestines actually have to do is break down the amino acids into either singular amino acids or at least into clumps of amino acids of only 3 or 4 amino acids long, so that your body can actually absorb them through the cell walls of your intestines and into your bloodstream to then go around your body. So yes, it can be useful to take on board more of the proteins that the amino acids that make collagen and absorb it. But the problem that I've got with my condition is it's okay taking on more and more of the amino acids, but my actual genetic makeup, the actual design plans of my body are wrong. So I can build more and more collagen, but it's still going to be deformed and incorrect. So yes, in theory, ensuring that you have a diet full of all your essential amino acids is beneficial to ensure that all of your body functions, all your ligaments and tendons and structures in your body and your skin, hair and nails is optimum by having all the optimum essential amino acids. Just by actually taking it as collagen isn't necessarily going to mean that it's going to go to the right places. So also to explain this, people want to sort of take what they call collagen peptides that are supposedly directed to your skin. Unfortunately, your body doesn't know that. So if you take this collagen product that has been labeled and advertised as being for your skin, but your body absorbs it, gets those amino acids and thinks, great, I do need some. I am a bit deficient in it, but I'm going to go make some tendons and some ligaments because that's where it's needed. It's not going to go, oh, you wanted your skin to be beautiful. Your body's going to actually use it where it wants to prioritize and use it first, not where you want to. So I am a good advocate for a healthy diet with all your amino acids, all the essential amino acids. If you do want to have specifically the amino acids for making up collagen, there are a few ways of getting that. And that is from animals and fish that are made up of collagen, because that's basically how the collagen peptides that are in the supplements are made, and that's how you would consume it. So bone broth is obviously one of the things that's promoted. Gelatin, sort of your jelly, also contains your collagen. You don't necessarily have to take it as an actual collagen supplement. For those that try and claim that their supplements are vegetarian collagen, there is no such thing as vegetarian collagen. Collagen is only a protein that's found in animals and fish. It's not found in plants. So basically what they're saying when you've got a vegetarian collagen supplement is that they've actually just found a plant source of the amino acids and the peptides that make up collagen within an animal once it's added to an animal. So it's not technically actual plant collagen because that doesn't exist. So yeah, there is some data out there that consuming collagen products do then increase in sort of skin elasticity and such like, but you never know with these trials on whether if the person was to just provide that collagen in food form, whether they would also have that same benefit. So it depends on whether you're willing to either invest in the payment for supplements or whether you're willing to invest in the time and the money with the correct food that have got the amino acids, if that makes sense. Yes, Brittany, I am a fan of continuing education, and yeah, that is one of my main reasons of starting this YouTube channel. I know out there people are really wanting to learn. Unfortunately, out there on Insta, TikTok, and such like, there's so much misinformation, and they sell it well. They really, really do sell the misinformation so well. They use pockets of truth, pockets of science that does exist to really confuse people and lead people down the wrong way, which is why I've set up this channel to really try and debunk that. That's okay. There's nothing wrong with being a lurker. I was a lurker a long time until I then got quite vocal and opinionated and started sharing all of my comments. Yes, I did actually talk about this in one of my previous lives, talking about mushrooms being anti-inflammatory. And yes, there are foods that are anti-inflammatory, and being anti-inflammatory or pro-inflammatory can be both good and bad both ways. So inflammation in itself is a mechanism by your body to provide healing. So if you get damage, if you get an injury, your body produces all of the chemicals required for inflammation to get all the white blood cells and platelets and everything else needed in the correct place to create healing. Unfortunately, sometimes it goes overboard and then causes damage. So as you would have in autoimmune disorders, when your body's own immune system then is actually in overdrive and damaging your body. So yeah, so in some cases, having either a pro-inflammatory food or anti-inflammatory food can be helpful. Yeah, there is that. And I did talk about mushrooms. They were talking about mushrooms for boosting your immune system and boosting your immune function. But as some people would already say, if you've got an autoimmune disorder where your immune system's already being active, then eating something that is actually promoting your immune system and such like can actually be worse. And so there is actually some warnings, and I think it was the shiitake mushrooms that have a pro-immune response. They actually show that if you take shiitake mushrooms and you have autoimmune disorders like MS, it can actually make the condition worse. So yeah, not always a good thing being fully sort of anti-inflammatory or boosting your immune system and such like. Yeah, so people are, there's a lot of people that say sort of after the age of 20, you lose 1% of your collagen a year. And then as you get to menopause, then your collagen degrades even quicker because it is known sort of estrogen does have, higher estrogen levels at pre-menopause, keeps the body at a higher repairing itself. And then as your estrogen drops off, your body's ability to repair drops off, and you don't replace your collagen as well. So that's, as you get older, you start getting wrinkles, your tendons and joints don't repair as well. And so people say sort of taking collagen supplements after menopause will help maintain that. You don't necessarily have to take collagen supplements. All you need to do is make sure that your diet, as you are aging, continues to have protein. So we all know that protein's good for children to have all the essential amino acids so that they can grow and build. We also know that bodybuilders, when they want to build muscles, need to have the amino acids for building the muscles. But also, just generally, as we get older, we need to continually be repairing our body and providing our body with those building blocks. So again, it's up to you whether you want to try and find your protein and essential amino acids from, natural food, or whether you want to have a supplement. So supplements are always an addition. They're not a replacement. If you think that you need that extra boost. One thing I would say with collagen is collagen doesn't contain all the essential amino acids that your body requires. It's only the amino acids that are present in collagen. And one of the essential amino acids that is not present in collagen, but is present in many sort of actual protein sources that you would eat, is tryptophan. And tryptophan is actually an amino acid that's required for your body to make serotonin. So there have been some trials and studies that showed if you're actually having way too much collagen, your body's then not going to be absorbing enough tryptophan from your other protein sources, that it can lead to maybe enhancing any depression that a person has. So that is one caution I would have. The other caution with taking collagen supplements is basically you are taking a large amount of protein into your stomach. So all the side effects that you would have from large amount of protein, of slowing your digestion, maybe causing nausea, can also happen with taking collagen supplements. Some people might like the fact that it actually sort of slows digestion and slows what they're eating. Yes, the mushroom coffees claiming, so yeah, one of my previous lives, if you have a look back, I did cover some of the mushrooms, but I am actually looking at two of my videos that I want to actually do as actual proper videos. Is one's on the mushroom coffees and all the different mushroom supplements and whether there's any evidence, because there is some evidence for some of the different mushrooms. There's hundreds of different chemicals and substances in mushrooms, and some of them actually have shown to be helpful to be taken alongside, chemotherapy and radiotherapy, not in replacement of, but alongside. And they've also got other sort of helpful benefits. So I was going to look into that. Another one of the ones that I'm also going to look into is the mud shakes. So you have to think, because sometimes when they say mud shakes, they mean mushrooms, and sometimes when they say the mud shakes, they mean the actual ones where they're actually using actual peat mud, the fulvic acid into shakes. And I'm going to do a whole video on that because that is just very confusing. Yeah, I'm glad you agree, Chelsea. There really, really is. Yeah, definitely. I'm all for professional development. There's so much new stuff every year. We've really got to keep on top of it. One of my main areas of work is I do a lot with what we call the MABs and the NIBs, and these are biological agents that are used for people with very severe autoimmune disorders, so rheumatoid arthritis, psoriatic arthritis, psoriasis, ulcerative colitis, and such like. And we're getting more and more of these nibs and mabs pretty much every month there's a new one, and pretty much every month even old ones have now got licensing and dosings for even more conditions. We've got ones that are helping against inflammatory asthma. We've got ones that actually help with reducing your cholesterol levels. They're pretty much getting into every single section of medicine. We've got the ones that are injected into the eye for age-related macular degeneration. So if anybody ever wants me to pull out being squeamish about eyes and eye injections, I can go into great detail about how many millions of pounds the NHS is investing in age-related macular degeneration. Yeah, I have to say, just don't muck with coffee. Coffee is coffee is coffee, and it's great. Taking coffee orally, the coffee bean is a great source of fibers. It's a great source of polyphenols. It's got great source of caffeine, and caffeine does have benefits. I talked in one of my previous lives about nootropics, which are basically medicines that improve brain function, and caffeine being the best one at helping your brain be alert. And even caffeine is excellent for those with ADHD who can't get actual medication, being able to self-medicate with, to actually calm the mind. It works the opposite way for people with ADHD. It actually calms their mind down so that they can actually focus, whereas for those without ADHD, it stimulates the mind to help them focus. Nikita, consuming coffee to help with anxiety can sound counterproductive because, caffeine does increase your heart rate. It does increase your adrenaline. And so that can cause sort of anxiety symptoms. But actually, with people with ADHD, it actually can calm their anxiety because it can allow them to actually function better. And also, if your anxiety is around getting stuff done and coffee then helps you get things done, then it is going to help your anxiety. Yeah, I might be quite a bit behind on these. Garlic. Okay. So garlic is something that people can have problems with. Mostly the positive effects of garlic are shown on the cardiovascular system and can improve sort of your blood flow and your heart function. So it used to be recommended. I don't think they do as much now because now there's more medication that's proven to help your heart. Nobody goes along the lines of the garlic. Garlic is part of the onion family, and people who have problems with onions being inflammatory and triggering, so onions can cause quite a lot of inflammatory issues with the gut. So I wouldn't be surprised if it also causes immune issues with the joints as well. The one interesting thing about garlic is that there is only one way that the garlic can actually be excreted out of your body. The liver doesn't do anything to it. The kidneys don't do anything to it. The only way the garlic's excreted out your body is through your sweat pores. So it doesn't matter whether you take odorless garlic supplements. If you take garlic, you will smell garlic because that's how it's excreted out your body. Oh, yes, Elsie. Yeah. So gut health. Yes, you do need to ensure that you're consuming a nice range of products, especially plant products, high fiber products to help your gut microbiome, help that be good. And then having a healthy gut microbiome does ensure that you have all your the gut producing all the micronutrients and different chemicals in your gut so that it functions well. But just getting your gut health producing all its chemicals correctly. And yes, there is serotonin in the gut. You've got receptors in the gut that require serotonin. You've got opioid receptors in the gut like you do all around your body. But just because you get serotonin in your gut doesn't mean that it has any relation to any serotonin in your brain. Also, the fact that serotonin in your brain is what is required as a happy hormone to treat depression is also being debunked, as in it's a lot more complicated than just having more serotonin in your brain to treat depression. It's a lot more complicated than that. It's a whole pathways of neurons and neurotransmitters. So yeah, so I did talk about this in a previous live when I was talking about how I hate Amare, the mental wellness company. And it's like saying that, yeah, you have workers in a whole office tower block, and you've got the workers in the basement, and you've got serotonin workers in the basement, but you've also got them working on the top floor as well. And although, yeah, you might have an excess at the bottom or the top, and you might sort of redistribute them, the work that's being done at the bottom floor isn't going to necessarily reflect the work on the top floor. And although you have the staircase and communication between them telling each other what to do, yeah, they are two separate areas. Oh, no, that's a real shame. Yeah, I do like a ramen. Luckily, I'm fine with garlic, but I have problems with different things. I've got an allergy to pineapple. It breaks me out in mouth ulcers, and also I have an allergy to certain types of melted cheeses. Something to do with certain types of oils makes me ill, but it's all a bit complicated. But yeah, it's really annoying when you have sort of food intolerances and food allergies and things that cause problems. Hi, Patricia. Welcome to the live stream. Essential oils. Oh, excellent. Firstly, the majority of essential oils should never, I would say 99% of essential oils should never, ever be consumed orally. That is my disclaimer. Put that straight out there. Yes, essential oils, they can smell nice. Aromatherapy can help you feel good. You know, smell is one of the most basic of senses that can really sort of trigger different emotions. You know, you can smell something can be triggered back to when you were 5-year-old and that smell. So having different essential oils to help with your well-being, helping reduce anxiety, helping with sleep and such like, because of, you know, the smell really sort of helping you be in the correct emotional state, obviously alongside everything else. You can't just smell lavender, fall asleep, you know, still with the relaxing everything else. Then yeah, aromatherapy, and there are people specially trained in aromatherapy understand the different essential oils, whether they're invigorating, relaxing and such like. And I'm sure that the people that have actually studied it properly for years and understand that, get very fed up with these people who can think that they're just selling products for a company and know what they're on about. I did just watch a good documentary on Netflix called Unwell, and the first episode of that was on essential oils, and they did actually interview some people that were true aromatherapists and used it in the correct setting to sort of help with palliative care, helping somebody feel relaxed, and then going on about Young Living and doTERRA. So yeah, so there are some situations where using essential oils for that sort of reason is correct. As for whether they can treat anything and everything, can be cure-all for anything and everything, most probably not. There is a couple of things that are useful. So yes, tea tree does seem to have slight antibacterial, antifungal, antiviral effects. So it can be useful added into certain sort of, you know, so into certain sort of products at a very low dose, can be helpful. Never, ever apply tea tree oil neat onto the skin because it is just too harsh and toxic. It's like saying, well, it's things like silver and such. Like I've done a video on colloidal silver if anybody's interested in that. Just because something is antibacterial and it kills bacteria, fungus, and viruses doesn't mean it's sensible to eat. Bleach does. We do not recommend taking bleach internally because it also kills your actual cells as well as things. So it's all sort of, used in moderation. Just because something helps on the outside doesn't necessarily mean it's going to help on the inside. Now, when it comes to the only essential oils I would actually say is useful, then that can be taken internally, and it has actually been made into a medicinal product. So when people say against Big Pharma, if essential oils really did work, Big Pharma would take them and use them and make money out of them, rather than these essential oil companies that are taking them, using them and making money out of them in exactly the same way that they blame Big Pharma. They did take peppermint oil, and peppermint oil in very, very low doses, really sort of like 0.2%, can help with IBS symptoms and with stomach cramps. However, you do need to be really, really careful with concentrations. There was actually a case study, I think it was an actual death of a child who, instead of being given the diluted form of peppermint oil for treatment, was given it in a concentrated form. And it caused major learnings in the reconstitution of products by community pharmacies, and that there needs to be real, real stringent controls of products which you have on the shelf that could be dangerous and toxic in their undiluted form that require dilution. So now peppermint oil, you would only actually have it in the peppermint oil capsules or products that are actually at the correct, really low concentration that can be used. But yeah, Big Pharma did take on peppermint oil capsules. They made Colpramin in the UK and charged quite a little bit of money about it. But yeah, if you do have IBS and struggle with cramps, then you can go to a health food shop nowadays and find peppermint oil capsules where it's actually been diluted down into the correct quantity, and very occasionally taking peppermint oil can help. The other thing, I'd say that pretty much it with the essential oils. I'll have a think on it, and I probably will do at some point an actual video about which essential oils can be. Painkiller for degeneration. When I find something for my back pain, it's difficult. Opioids in chronic pain don't actually work that well, unfortunately. Although opioids are the gold standard for acute pain and possibly for cancer pain, where you can up the dose and not really worry about the long-term effects. For actual chronic pain, the amount of benefit that you get from opioids diminishes the longer you take it, the more the tolerance, you're building it up, and then opioids itself can actually then contribute to the pain. So although most people with chronic degenerative joints end up on opioids, they're not the best thing. If there is nerve trapping and nerve component to it, then sometimes going along the medication for neuropathic pain, such as some of the tricyclic antidepressants that act on the nerve signals, and some of the anti-epileptics such as gabapentin, pregabalin, that act on the nerve signals, they can be helping if there's actually sort of compression onto nerves. Sometimes the actual paracetamol, just a baseline of paracetamol, can help take a certain amount off. Obviously, it's not going to do much, but it can take a certain amount off, so that to allow other things that are then done on top of that to be more effective. And actually always combining paracetamol with an opioid does make the opioid work better. Also, adding caffeine to paracetamol makes the paracetamol work better, as long as it's not too late at night and it's going to keep you awake. NSAIDs in the beginning of inflammation can help, but not long-term NSAIDs, because long-term NSAIDs have long-term side effects and profiles. Also, as somebody, if you've got an acute injury, sometimes you need that inflammation in the first 24, 48 hours. So sometimes you might want to hold off on taking the NSAIDs because actually you're needing your body to do the repairing first. So it's very complicated. I've just scratched the surface on that. So maybe if you've got specific questions, I can start asking, and maybe that's something that I need to think of doing an actual longer video on, where I can actually get my thoughts and process put in. Right. Yeah, the mud drinks do sound gross. There's already been a few creators done things on this. I can't remember whether it was Kat or Brianna who were doing, is it the company Boo, something organics? But yeah, so you can look them up. All the drinks on that, the MLM that does the fulvic acid mud drinks. Yeah, the eye injections do sound terrifying. And even though I told my boss that I was squeamish about eyes, he still put me in charge of looking at the eye injections. He was so kind. It's not truly free of caffeine, no. So it depends on the type of decaf coffee, but historically, decaf coffee is caffeinated coffee that's been through a process where they've added chemicals to it to try and remove out the caffeine from it, and they can't always guarantee that they get all the caffeine out of it. Now, my mum is a chemist, as in she's a proper chemist. She's got a bachelor's in chemistry degree, and she used to work as an industrial chemist, analysing different things. And for one of her projects at university, she measured the levels of caffeine in coffee, tea, and decaf coffee, and found that there was caffeine in decaf coffee. The process might have improved over the next couple of decades, but yeah, it's not always truly decaf. I can also raise the thing, I talked about it last time, but just because something says it's THC free when it's a CBD product doesn't necessarily guarantee it is, unless they've actually got proper official third-party testing to check. Right. Yes, an ADHDer and autistics, coffee can actually put you to sleep, because normally your head is just so crazy, so all over the place, going off all over the place, that actually adding in the caffeine and the stimulant actually allows your brain to actually focus on just one thing, the sleep, and you can sleep. There's millions of TikToks out there and such like that explain that much better than I can. But yeah, I have to say, when you hear of people that say that actually they have a coffee to go to sleep, I do then have a quick chuckle and have a think about whether do they fit the traits of being on the spectrum or not. Yeah, I class it as the worst. It definitely, to me, I class it as the worst one, especially seeing as the people that I follow on Insta are definitely the worst. The people I'm talking about, Clown Town has done some good videos about, but yeah, I can pass it on to all the good MLM, anti-MLM creators that have covered them. Cabs and serotonin, they probably don't relate necessarily, as in they are two totally separate pathways. Serotonin is made from tryptophan, which is an amino acid. That's what your body actually uses for creating serotonin levels. And serotonin levels are, for the general use, sort of for brain function, is made in the pineal gland. And Obviously, the more balanced you are with your carb levels during the day, then you probably more level your pineal gland will be at keeping it. But I don't think there's any actual definite link, but that isn't anything that I've actually done any research into. So I'm just total sort of trying to just think logically about what I know. They really are. The amount of misinformation out there about serotonin. The fact is that even with the serotonin selective reuptake inhibitors, they still, even the top psychiatrists and everything, they don't really know how it works and whether it's actually got anything to do with increasing serotonin levels on how they actually work with treating the depression. They're still unsure about. So, yeah. Definitely essential oils around pets. Yeah. So many essential oils can be toxic to pets and keep them well aware. If ever you're dubious, I would phone up a vet, and vet toxicology can let you know whether things are allergic. There is also the fact that quite a few essential oils are they're not recommended in pregnancy. Somebody who has done a true aromatherapy course will be able to tell you whether they are, or you can think, but yeah, you do have to be careful. Just because something natural doesn't mean it's safe. You know, many of the major toxins in life are natural. The majority of plants, well, you've probably all been out there, but the majority of plants have made over evolution have learnt to make chemicals to stop predators eating them so that they can survive. So they've learnt to make toxic chemicals that will kill predators and put predators off from eating them. So nettle stings are an irritant, and that's the reason why it's to keep certain predators off them. Poison ivy. You've got things like the digitalis, the foxglove. So they use it to make defense mechanisms. So just because something is natural actually could mean that they're more likely to be problematic. Also, the majority of allergens are actually proteins, and proteins are only found naturally. So the top allergens are the proteins that are found in milk, the proteins found in peanuts, the proteins found in soy, the proteins found in gluten. So they're all naturally based. Some of the most major things that are unsafe are natural. Yeah. Oh, I'm too young to have a genetic disorder, Nikita. I get that type of thing. You know, I'm struggling to walk and people go, oh, but you're so young. And I'm like, but it's a genetic disorder. I've had it since I was born with. But yeah, I've had that because of with the Ehlers-Danlos syndrome, all of my joints can move. That also includes the joint between the spine and the pelvis, which people, for the majority of people, don't even classify it as a joint because usually it's fused, but it moves for me, traps the sciatic nerve, and I've ended up before losing feeling down one leg and collapsing straight out. I did that in Wilco's, and I did that walking between two friends' house. But yeah, the pain of sciatic there is quite a few good physiotherapy sort of exercises that I now use to try and sort of relieve the tension in that joint and relieve the pressure that's on my sciatic nerve. But yeah, that's why sort of physiotherapy and chiropractors can be useful. But that's chiropractors as in chiropractors that are actually just manipulating the muscles and the joints to actually put things back in alignment, not the ones that are wanting to put you back in alignment to treat anything and everything. I think that, you know, there's good and bad in every different type of yeah, codeine. Oh, yeah. So, so codeine and any of the opioids can cause allergic reactions and can cause in themselves, one of their side effects is itch. And I love it. I can't remember who did the song. I think it was Pink. And they said, and your morphine's making me itch. And I'm like, yes, get that information out there. As for codeine, when my granny was on morphine and codeine, either morphine or codeine, she has very vivid hallucinations and night terrors. Things literally like the mafia were after her, and there were big spider bats attaching her. Yes, Sam. So Black Oxygen Organics, that's what I was thinking of. They were shut down. They're trying to make a resurge. So I'm hoping that you're meaning that they're being shut down again. That's what Lisa's saying. Yeah. So they went out of business, but there's another MLM. But yeah, but I think it's the same people, just under a different name. I'm not quite sure. I did watch a couple of videos, but there's how much about MLMs out there that I can't keep on top of all of it. Luckily in my job, very, very well. One of my best friends at work is in the dietetics department because I'm working on a project with dietitians. So I work for what is called medicines optimization at the Integrated Care Board. So I actually deal with writing guidelines and protocols for GPs and consultants. I work on sort of the interface between primary and secondary care, about what drugs can be used in secondary care, primary care, when they can get passed between them. And we also work on high-level projects on different things. So one of the jobs that we did was all of our GPs were complaining that there's the high cost of dietetic products on prescription, such as all your enteral feeds, gluten products, enteral feeds, baby milks, and such like, and they didn't know what they were doing, but they were getting charged on their prescriptions for it, and they didn't know how to control it. So we actually set up in our local area that we actually employed more dietitians to be fully in control of that. So in our area, when somebody goes to the GP wanting either gluten-free or they're needing SIP feeds because they're losing weight, or they need enteral feeds to go in directly through an NG tube, or peg feeds, they actually get referred to the dietitians, which will see them literally within a couple of days, depending on the urgency. And then the dietitians do all of the prescribing of that. So I actually work quite well closely with dietitians with that. We've also recently been setting up more processes for using our dietitians much earlier on in the process for diabetes. So when somebody gets diagnosed with pre-diabetes, they can have a referral to a dietitian for some support. If they get diagnosed with diabetes, they can get referred to the dietitian for support, and at every stage. So if they're thinking of giving them insulin before they think about giving them insulin for type 2 diabetes, they can go see a dietitian to see if they can prevent them going onto insulin, because once you get onto insulin with type 2 diabetes, it can be a vicious circle. So, yeah. Definitely, I don't use them anywhere near my 2 cats and my 2 rabbits, all of which have not around at the moment, so I can't see them. They have appeared on previous ones. Oh, rabbit hole. Medical misinformation. I have to say, recently it was the colloidal silver. That one was, and the bloke that turned himself into Papa Smurf. But yeah, I've been down quite a few different rabbit holes. I also quite often like going about looking at the medical information about treatments for rabbits and cats. And well, yeah, the other one was the dog dewormers, because I was actually laughing at the thought of dog dewormers treating cancer. But then when you actually looked at the anti-parasite, there was actually some companies looking at anti-parasite treatments for the treatment of cancer, not that anything ever came of it. Yeah, so yeah, they don't. So there's certain conditions that affect certain age groups more likely, but everything is always risk factors. So even like a heart attack, as you get older, the risk of having a heart attack is more, but that doesn't mean that you can't have one when you're young and that you're definitely going to have one when you're old. It's all just relative risk, and different things can alter your risk factors. But yeah, diseases don't care. They just, yeah. And they also don't always care about what the risk factors are. They can just suddenly hit out of the blue. And I finally caught up with everybody asking me questions. So yeah. I probably would say that there are certain conditions, things like autoimmune conditions, where people just do tend to be a lot more sensitive to medications, and are more likely to have side effects, and quite often need to have a lower dose. But just because you're more sensitive, as in requiring a lower dose because the higher doses cause side effects, doesn't mean that having a lower dose also means that it works just as effectively, which can be very annoying. But I'm glad that you actually talked to a proper allergist about that, because sometimes people get labelled with allergies that are not allergies, and they could technically have something if they could have cover for whatever side effect it was causing. Yes, so it was based on something. A vet was quoting to this Korean bloke about some medical research that was being done on one of the azole dewormers, and there was some research being done, but nothing actually ever came of it. And he told this Korean man that there was this research being done, and it's the same stuff that was in the dog dewormer. So why don't you try taking it? And he tried taking it, but he was taking it alongside the chemotherapy and the radiotherapy he was having. His cancer did go into remission. He sent on TikTok that he was taking the dewormer and he's gone into remission, but forgot to tell everybody that it was the chemo and radiotherapy that did that. But then he did weeks later go back on and go, I don't think the dewormer did anything. I think it was the chemo and the radiotherapy, and backtracked, but that never got any traction and nobody ever listened to that. They just listened to the first bit of the misinformation and not the correction, which is the problem everywhere, where people will say the misinformation, it will go viral on all the platforms, but the correction never does go viral. And that really is a big problem. Hi, Natasha. Although I am going to say, unfortunately, I've been on here now for just over an hour, and I need to actually have my tea because it's gone 7 p.m. here. So I am probably going to finish the live now, but it has been great to have you all on. It's been great. I didn't plan anything, but we've still managed to cover a lot of different subjects. I hope you really enjoyed that. If you did and you're not already subscribed, I would love it if you could subscribe. I would love it if you could comment on my videos, so that YouTube tries to share out this actual information. And oh yeah, excellent, catch the replay. And with me trying to monetize, if you could encourage people to sort of watch my content so that I can get the watch hours, that would be brilliant as well. So thank you everybody for coming along and yeah, asking your questions and listening to me ramble. And hopefully I've educated you all a bit on some yeah, actual information, medical information. So thank you, and I'll see you all again soon.